Hi, I'm Dr. Persida Soriano Cocos, an OB/GYN oncologist at Adventist Medical Center, Manila. Today, we will be discussing about cervical cancer. Cervical cancer is malignancy arising from the cervix or the lower part of the uterus. In Tagalog, we call it the kuwelyo ng matres. Do you know that cervical cancer is the most common gynecologic malignancy in the Philippines and in most developing countries? Cervical cancer also is the second most common cancers among women, next only to breast cancer. And the cause of cervical cancer is the virus HPV or the human papilloma virus. And this is a sexually transmitted infection. So the risk factors for cervical cancer are sex-related. Number one is a very early sexual debut or very early coitarch, meaning even in the teenage years, you started already sexual activity. Number two is having multiple sexual partners. Or if you are monogamous, but your partner also has other sexual partners, then you are also at risk. A history of sexually transmitted disease or sexually transmitted infection like chlamydia can also increase your risk for cervical cancer. Another risk factor is multiparity, having many children. Another risk factor is smoking. Smoking is said to decrease your immune system to fight the HPV infection. There are signs and symptoms of cervical cancer. Unfortunately, if it's very early, then it could be asymptomatic, no signs or symptoms whatsoever. But later on, you will complain of postcoital bleeding or contact bleeding. Another symptom is foul vaginal discharge. And of course, another sign or symptom is the presence of a cervical mass when you do a pelvic examination. So how do we diagnose cervical cancer? We do it by taking a sample which we call biopsy of the cervical mass. And this is sent for histopathology. And if it comes back positive, then we have to treat it. If it's very early, we can still do surgery for early stages of cervical cancer. But for all other stages, we do radiation. This is the main treatment, and ideally, it should be done concurrent with chemotherapy. The prognosis for this cancer is very good if it is diagnosed and treated early. So how do we prevent cervical cancer? Number one, for our teenage females, you have to delay sex. Don't hurry. Wait, because in the end, it is you who will suffer the consequences of very early sexual activity. Number two is having a mutually monogamous sexual relationship. So there should be no third party, no multiple sexual partners in your relationship. Number three is don't smoke. Number four, have a regular pap smear with your obstetrician gynecologist. This is a cervical cancer screening method. They look for abnormal cells in the pap smear. Number five is HPV test. This is a test to screen for the human papilloma virus in the vaginal discharge. And there are certain strains which can cause cancer of the cervix. Number 6 is cervical cancer vaccine. We have it available and we encourage our teenagers and also those who are still sexually active to avail of this vaccine. And number 7, very important also, is to boost your immune system by living a healthy lifestyle. More fruits and vegetables, adequate sleep, sunlight, and no vices, especially smoking. Thank you for watching and stay healthy.